Thank you for coming to Ingram High School, home of the Rams. I'm Martin Flo, principal at Ingram High School. As the principal for the last 18 years at Ingram High School, I've seen the changing needs for our youth in the city around mental health supports and the pressures that the students now have that future or past generations didn't have to deal with. I'm really excited for the unified approach to mental health that the city has taken. And again, welcome to Ingram High School, and I'd like to introduce Dr. Brent Jones. Excuse me, Superintendent Dr. Brent Jones.
Thank you, Martin. You know, this past few years have been extremely challenging for Seattle students, but they've shown tremendous strength and resilience. The COVID-19 pandemic and subsequent remote learning just disrupted some of the social-emotional opportunities that they had to grow and develop. But our youth have, again, been resilient, and they deserve investments from us as adults who are managing organizations that bring resources to our students. Seattle Public Schools has been working with mental health professionals, trying to make sure that we are resourcing social workers, mental health professionals, and doing all kind of things for partnering with entities like the City of Seattle and other entities to provide services for our youth. This initiative, Reach Out Seattle, is really about us coming together. We have 12 sectors that are going to be thinking about ways that we can be proactive and reactive to situations that students get involved with. But it's our collective energy, our collective effort that's going to make this so powerful. And with that said, our city leader, Mayor Harrell, has been lifting up the right things in the right ways, and he's been producing opportunities for us to get together and connect and make sure that we have investments that are going towards things that are really important. I admire his leadership, and we are deferring to him to coordinate, help us to really make sure that Seattle is one Seattle and that we have the resources for our young people to thrive. Without further ado, Mayor Harrell.
Thank you, Dr. Jones. I was so excited I tried to take Martin Flo, Principal Flo's role at starting this, and I apologize. Pretty excited about this, this initiative, this program, Reach Out Seattle. At the beginning of this introduction, I do want to start by remembering Ebenezer Hale Holly, if I'm pronouncing Ebenezer's name correctly, a 17-year-old who we all know was shot and killed last fall in the school we are in today here at Ingram. Our hearts remain with his family and friends and in his memory. We're called to take action, not because of his life or death, but because this issue that's happening in our schools throughout this country, and particularly here in Seattle, requires the kind of commitment that I'll describe in Reach Out Seattle. We start by making sure, as we do in most of our work, that as mayor, it's not a top-down approach, that we want to center and collaborate and take advice from our youth. That's why they are such a critical part of what we're trying to do. A thriving future for our city and for our youth will require us to take a new approach. Unprecedented mental health needs that are facing the students today are nothing to laugh at. And many of you know I try to bring a sense of humor and a sense of congeniality and collaboration wherever I go. I try to be the eternal optimist. And I continue to be. But with the trauma and the pain and the stress that our youth are facing today in the schools, when I was walking down here through the halls, it reminds me that the stakes have changed. Just life is differently. That how can you learn when you are facing trauma, pain, stress, anxieties? How can you be all you can be, your authentic self, when you have to look over your shoulder and constantly worry about gunfire, violence, bullying? So what are we going to do about it? We know that our young people deserve a safe, supportive environments to learn, grow, and reach adulthood. What is our role? What can we do? So we believe in our Reach Out Seattle initiative that we will unify our approach to prevention and early intervention and help young people access the resources they need to lead healthy lives. One of the first things we always ask in a situation where something went sideways is, well, did anyone know? Were there signs? Did someone have a discussion with that person last week or a week ago? Was there untreated trauma that needs to be addressed? This vision we are establishing will center our city's diversity with an emphasis on how we can reach youth, particularly in historically underserved communities, youth without access to health insurance, and youth in communities who experience health inequities. In other words, we go where those who are most vulnerable, but we don't leave anyone behind. Mental health conditions are real and treatable. Part of this work in this initiative is to destigmatize how we discuss mental health, how we raise community awareness about the nature of the crisis we are seeing. This initiative's approach is based off of Seattle Fire Department's Medic 1 and Medic 2 model, developing a community-wide learning program and empowering community members, family members, neighborhood organizations, and I'll talk about it's centered around 12 sectors in a minute. I'll describe those sectors. How we equip them and program them and prepare them and educate them to recognize the signs of youth in psychological distress. Critical work. These community learning programs will be created with input from our youth to make sure it meets their needs. That's why I started by saying it's not going to be a top-down approach, along with the expertise of our first responders and local mental health providers like Seattle Children's Hospital and other partners. Youth experiencing mental health challenges deserve compassion, care, love, support from adults. We must instill hope and teach them it is okay to reach out for help. Quite candidly, I even tell my own staff that. I tell everyone around it's okay to reach out for help. By focusing on the youth, we can disrupt the progression to adult disease and create a healthier future for our youth and our entire community. This is upstream work. Effective upstream prevention and early intervention can prevent severe mental illness, decrease the need for intensive inpatient hospitalizations, and ultimately reduce the risk of relapse of related mental health conditions. This new initiative will complement the $9.4 million investment the city made in our 2023 budget that we passed to expand mental health resources at school-based health centers. Part of that investment includes a new student mental health supports pilot program through the Department of Education and Early Learning, and our director here, Mr. Chappelle, is here, and we're pleased that one of the pilots will be launched right here at Ingram High School. We have some excellent leaders here today that will speak more in depth about this exciting Reach Out Seattle. So I'm going to introduce first Dr. Leslie Walker from Seattle Children's Hospital, but I don't want to just say it that way because she indeed has an impressive bio, so I'm not going to read it all. It was like this long from Wikipedia. I'm just joking. Dr. Harding, where are you? Sorry. Dr. Leslie Walker Harding is the Ford Morgan Endowed Professor and Chair of the Department of Pediatrics, as well as Associate Dean for the University of Washington. She is also the Chief Academic Officer and Senior Vice President for Seattle Children's Hospital. She's been dedicated to the health and well-being of children and adolescents for over 25 years, particularly in the area of prevention of adolescent substance use and promotion of healthy adolescent development. Now, her current focus is to raise awareness of and bring to national scale proven interventions to prevent the development of substance use and mental health conditions in children and adolescents. So I'm going to stop there before she takes the podium and say, when you're sort of a coach of a city or sort of a mayor, you just got to get a lot of people smarter than you. It's not easier to do for me. But you have to get superstars who are committed to this kind of work, the best of the best. And for that, I present to you Dr. Leslie Walker Harding, helping us lead this initiative. Dr. Harding.
Thank you, and good morning, and thank you, Mayor Harrell, for that long introduction. But it's really wonderful to be here today to be able to help kick off this important youth initiative. As Mayor Harrell said, I have spent a lot of time working with adolescents around prevention, intervention, and treatment of substance use, mental health, and behavioral health issues that affect adolescents and young adults. So this is very important to me and to the city. As the mayor noted, national surveys of young people have shown alarming increases in the prevalence of mental health and behavioral health challenges. Prior to COVID-19, the CDC data stated that 1 in 5 young people was dealing with a mental health disorder. Since COVID time, there are some studies that are saying now it's more like 1 in 3 adolescent youth are dealing with the mental health disorder, and in particular adolescent girls. The rates of youth experiencing mental health challenges clearly have increased since the pandemic, and it's heavily affected those who are very vulnerable, people who had pre-existing mental health concerns, youth of color, disabilities, young people who are LGBTQ+, as well as others from diverse backgrounds who are at increased risk. Not only has the pandemic had an enormous impact on youth mental health, but it's also created additional barriers and challenges in access to treatment. The CDC estimates that only 20% of youth who have a diagnosable, treatable mental health condition actually are able to talk with a mental health provider. And what's so heart-wrenching about this is that even that 20%, only that 20%, is really overwhelming our mental health system as it is right now. At Seattle Children's Hospital, we see and feel the impacts of this every single day. The mental health crisis is bringing more and more young people to our emergency room. Many have to stay there days and weeks because there's nowhere to send them. The mental health floors in the hospital are full. We have many, many people on the medical floors with mental health conditions. There's nowhere to send them to, and it's heart-wrenching to see this happen to our youth and see them in need of such help. That's why we're here to support the launch of Reach Out Seattle, which will take a comprehensive approach that we really need from every sector of the city to help our youth deal with mental health crisis and build a healthier future for them. The model of Reach Out Seattle is focused on prevention, early intervention, and identification of youth mental health challenges through the community learning programs and through public education campaigns. With limited availability of psychological services and providers, prevention and early intervention are key and critical to being successful with this model. The goal is to ultimately decrease the need for high-intensity inpatient hospitalizations by empowering parents, caregivers, and trusted adults to be first responders in the community. Developed with youth and mental and behavioral health providers, the community learning programs will educate those who work with young people to recognize the signs of someone struggling as part of prevention and early intervention. Rooted in the principles of youth psychological first aid, the intervention component is focused on non-clinical interventions that work. And will provide adults with tools needed to respond to youth in crisis, as well as provide youth with tools needed to respond to their peers in crisis, support them, and help them get on the path to wellness. If clinical interventions are needed, then the initiative will also provide an accessible list of resources to coordinate access. The learning programs will be accessible, scalable, and culturally responsive to meet the diverse needs of the Seattle community, with special emphasis on the communities that experience the highest burden of health inequity. By creating a coordinated system with all the sectors of the city, there won't be a wrong door. Every door will be the right door for support and services for our youth. And families will have the opportunity to move beyond the current mental health crisis to thriving and having our youth live to the fullest potential. So thank you for listening for a moment, and I do pass it on to Director Reba Gonzalez.
Good morning, everybody. I was honored to work for the Seattle Fire Department for 3 decades and now direct the Care Department, which has a 911 call center, and his task was designing appropriate emergency responses to folks experiencing a mental health crisis. Our fire department here in Seattle made a huge contribution to public health when it began the Medic One program in 1970. This is when the first group of firefighters were trained as paramedics with help from Harborview Medical Center and the University of Washington. The success of Medic One taught us that the community can play a crucial role in prevention and rapid response to an emergency, and that non-medical professionals can play a significant role in saving lives. Building on the successful community engagement approach of Medic One and the Medic Two program was started in 1971 to provide training classes in CPR and choking techniques. It was prompted by research showing that prompt bystander CPR and doubles a patient's chances of becoming a long-term survivor. Reach Out Seattle is inspired by the Medic One and Medic Two training programs. When we think about how to strengthen youth resiliency and prevent mental health crises from happening, we can learn from the grassroots engagement approach Seattle Fire took to community engagement. We will survey the landscape for what people and institutions interact with our young people, and especially identify who has influence, and craft an engagement strategy that is appropriate for the audience. We will leverage the resources of libraries, community centers, and private sector. We will design training for people who are not necessarily subject matter experts and craft messaging that is clear, concise, and memorable. We will raise public awareness about what a mental health crisis can look like, especially at early stages, so our young people do not go into adulthood without the tools they need to be successful. Research consistently demonstrates that mental health crisis is often not identified or treated until around 14 years after symptoms appeared. Think of all the suffering that could be alleviated or avoided if we could close that gap. I know that the kind of change we want for our young community requires every part of our community to come together in a united commitment. This is the spirit of One Seattle, and we are so honored to be part of this. These are our kids, and they deserve our very best effort. I'd like to now introduce Keaton Soni, who is a Seattle Student Union representative.
Hi, everyone. My name is Chayton, and I'm the executive director for the Seattle Student Union. We're an organization dedicated to making positive change in Seattle and Washington State through student activism. First of all, I want to thank all the city leaders here today announcing this program and the introduction of Reach Out Seattle. As a student, I, along with my peers, grew up in an increased crisis of gun violence across the country. Since elementary school, we've had to practice active lockdowns, hiding in a corner, pulling down the blinds, and staying absolutely, completely silent because we knew one day our lives would depend on it. During a lockdown, you don't know what's happening or why. You just remember your teacher hiding you as they hear jiggling or shaking of the doorknob and then the pounding of the door. In middle school, I was in 2 lockdowns within the same year, 2 moments where we knew that whoever it was, they were coming. That feeling stays with you and it never goes away. Every single hour and every single day. That is how often students, staff, and teachers think about gun violence at school. Gun violence and youth mental health are interconnected like no other issue. Mental health issues also continue to rise among youth. A new study from the CDC points out that 45% of youth had poor mental health, and within the last year, 22% have seriously considered suicide. That's an increase of over 10% over the past 10 years. Over the past 2 years, I've watched as my classmates' mental health deteriorates, somewhat over the weight of social media, but I've noticed something else. Once students realize the crushing weight of the world's problems, climate change, mass shootings, huge economic disparities, COVID-19, and I'm sure there's more that I'm missing, things can start to get hopeless. Gen Z is the most tapped into current events, but it can come at a severe cost. To all the youth listening, know that we see you, we hear you, and we're here for you. Adults need to be able to talk to youth about these issues and create spaces, both in school and out of school, where students and young people can feel like they belong. whether that's through increasing counseling services available at schools, or simply just having a teacher or identifying who to talk to. We need to know that we have a support system. We not only need a support system, but when someone is in crisis, adults need to do everything they can to reach and calm that student or young person down. It's gonna take all of us to solve this increasing crisis. Thank you. I wanna now.
Clap-worthy.
I now want to introduce Max Santiago, an Ingram High School 9th grader.
Hello, my name is Max Santiago, and yeah. Hi, my name is Max Santiago. I'm a 9th grader at Ingram High School, and today I'm here to talk about mental health importance. Over the past 3 years, mental health, thank you.
That's not for amplification. It's just for recording.
Over the past 3 years, depression and suicide rates in teens has increased. But why has it increased? Well, that's because of COVID-19. Teens over COVID-19 experienced a lot of isolation, and through that isolation, not being able to talk to people or knowing how to deal with the weight of the world at the time. The after effects of COVID led into serious depression for teens. And it's important to talk about this and understand it so that we can figure out ways that we can get resources out there for teens who are struggling and understand what it is like to really be a teen at this age and time. Because most people would think of teen mental health as the time of when they were a teenager and go straight to how things were for them, seeming like that time was worse. But everybody's going to go through something, and it's going to go in different ways, but it matters, and it matters now. So that's why it's important to talk about mental health. Thank you.
The voice of the youth, powerful. And this is not for amplification, it's just for recording. They're all plugged into it. So before I take some questions, I just want to say some closing remarks. This work, this concept, this effort, there's a few folks I'd love to thank, including the First Lady, my wife, Joanne Harrell. I'd like to thank her publicly, and I'm going to thank some other people, but I want to just sort of use that as an example. That Joanne and I have been together a long time, and even though I try to keep a happy face on all the time, she could always tell when something's bothering me. I'm smiling. What do you mean? No, something's bothering you. And I say that to say that the safeguard that at least we have in our family to detect pain or anxiety or concern, that we have that. Many people do not. And sometimes it's untreated and asymptomatic, and this work that we heard from our youth, that is why this is so important. And having said that, I want to go down the list to thank a few other folks. Our Executive General Manager Adiam Emery, Dr. Janine Jones from the University of Washington, Dr. Walker Harding, who you heard from Seattle Children's Hospital, Jean Anderson. Where's Jean? She's fixing that mic and stuff, because we all know who Jean Anderson is. Thank you for your passion for this work and your leadership. Seattle's Department of Education and Early Learning, Seattle Public Schools, Seattle Student Union representatives, Cheaton Sony and Nori Goldberg. Nice slaughtered your names, right? Was I in the ballpark? Okay, that's all. That's okay. Public Health in Seattle and King County. The Seattle Channel, who produced some excellent public service announcements to raise awareness, the importance of youth mental health, that you will soon see on social media and television. We have to get the word out. This is almost like we see the symptoms of it. Now we want people to know that we're trying to actively and intentionally address the issue. I also want to advertise that this evening we'll have a teen town hall and resource fair tonight at Langston Hughes Performing Arts Center from 5 to 7 p.m. I'll be there, and many of our cabinet members will be there, again, to have a dialogue with our youth about resources available and about this effort that we are talking about this morning. This event is an opportunity for our youth to learn more about city and community resources available to them, like employment and recreational opportunities, the one I'm talking about tonight, so we're excited to host that this evening. And I want to thank all of you, everyone here that doesn't have a camera in front of them. I want to thank all of you for your support. When I talk about One Seattle, I talk about everyone just coming together as one, recognizing on this particular issue the assistance that our youth need. But more importantly, the opportunity we have to give them assistance. Exciting stuff. And with that, we'll take some questions.
Mayor, if I could start out with the intervention component and just what that's going to look like. Is there going to be teachers being trained, or is it going to be a proactive element versus students coming in and asking for help or parents asking?
Yes, let me take a shot at it, and then I'm going to ask some folks around me might be able to put a little more meat on the bone. So I earlier announced that we're looking around 12 sectors. Let me describe those sectors. Our youth, of course, parents, businesses, media, schools and school-based health services, youth and family serving organizations, including those focused on youth who are homeless or unstably housed, first responders, designated crisis responders, our unified care team, religious organizations, civic volunteer organizations, including those serving immigrant communities, healthcare providers, state, local, and tribal governments, and other organizations involved with youth and mental health care. So what we've identified are 12 sectors, if you will, where we'll get them the training, the education, the resources, the ability to recognize those who must be treated and dealt with and get them to the right resources. So it's a sector strategy identifying where we think we could most effectively and efficiently reach our youth who are in need.
So what does that training and intervention look like? You mentioned it being like a concept and an effort. Is anything concrete right now?
Yeah, I'll maybe refer to someone that has a DR in front of their name. Would you like to, this is Dr. Jones. Maybe she could hum a few bars.
Thank you for the questions. This is what we're doing is building the intervention component on principles of psychological first aid, which is a evidence-based approach to doing interventions for mental health when people are in crisis. And so the principles that we selected are safety is the first principle. Second is calm and comfort. A third principle is empowerment or self-efficacy. A fourth is connection, and the fifth is hope. And so by taking these 5 principles, we are designing a program where people are going to learn practical strategies on things to focus on, as well as getting scripts for things to say in response to a crisis or a concern. And so we want to build it out in a way that speaks to people that are not mental health professionals per se, that any one of us can use it. And the idea is that we're supposed to be able to be equipped with the skills to respond to the mental health needs of youth.
But nothing is done yet. That training is not available yet.
Not available yet, but it is outlined, yes. Yeah.
Do you know what a timeline for it?
Do we know a timeline? What'd you say? Fall is the intended timeline. Yeah.
And will it just be the social media and media ads? How will it get dispersed to people?
Do you want to say? Did you hear her question? Yeah, so this part is, sorry, I was not prepared for this. So the social media component is beginning now. We've done some videos with youth and then as well as with mental health experts to kind of talk about what are the principles. So those are just getting exposed to what the concepts are. And then the rollout will actually be including individuals, kind of teach the public. So having intervention opportunities to learn and actually continue to communicate within small groups so people can learn in their own settings.
And as Dr. Jones said, we're deployed to be rocketing and rolling in fall. That's our goal, to get out the social media started with it. There's still some workshops we're going to do, so the conversation starting now we hope to be up and running in fall. I also want to better introduce Dr. Janine Jones. She's a psychologist and she's the Associate Dean at the College of Education, University of Washington. And sorry I didn't give you your due. Any other questions? Yes.
Yeah, you mentioned substance abuse and how you want to lead with compassion. Given the decision and the vote by the Seattle City Council last night, and kind of what's up in the air regarding prosecuting people for drug possession, what is your stance on youth intervention? Is treatment the first option, diversion tactics? What's the plan for substance abuse?
It is. And what I've, and I'll address the issue about the City Council, if that's what we're talking about, that I've tried to make it very clear from this administration standpoint, we lead with intervention, we lead with treatment, that people who are suffering from both mental illness or drug misuse, health issues, it's a health issue. And when I talk about One Seattle, I quickly talk about compassion and love. And again, you know, walking the streets of Ingram just sort of reminds me when I was a kid in the dinosaur ages, you get a little scrape or a little fight with someone, then you see the person next day and you brag about who won because no one really knew, and life goes on. There was no social media bullying. There was no gun play to the level you see it now. And we know why people sometimes will go left or go right into a life of just not good things. I'll just put it that way. So yes, we will lead with intervention, we'll lead with prevention, we'll lead with care, and most importantly, we turn to our academicians for best practices. That's why we're so fortunate to have this kind of talent on our intervention work. So yes, we will lead with intervention.
The legislation that was voted on yesterday had no funding or mention of treatment. So what is the diversion plan for the youth or the adults regarding treatment in Seattle for substance abuse?
So let me ask you a question about, I think, the post-Blake decision. I think, is that what you're alluding to? So I'll just be direct, okay, because you're, in the next several weeks, and I talked to Councilmember Lewis this morning, in the next several weeks, I'll be meeting with several people, including the city attorney, the prosecuting attorney, Lisa Mannion, health specialists, treatment providers, people that are our police department, our law enforcement advocates, to come up with really what I'll call the spirit of a post-Blake world. Okay? What happened yesterday at City Council, for those that followed it, I watched portions of the hearing, that the process, I think, was less than ideal. That what should have happened is, when we look at the first issue comes up is, what is the spirit of the law? What are we trying to accomplish? What is the culture in Seattle? Under my watch, it's going to be one of compassion, one of treatment. And I'm asking our officers in this work that we're going to do is to look at it from to put it in very simple terms, two lenses. One is the person a threat to themselves? Are they unhealthy? Are they living the kind of life, for whatever reason, untreated trauma, institutional racism, whatever had led them to a path of harming themselves, drug use, and recognize this person needs help. On the other lens, are they a threat to others? The fact of the matter is, we have to make lawful and constitutional arrests when people are a threat to others. There's two lenses by which we must embrace the Blake decision. I've publicly talked about the war on drugs and talked about my experience growing up in the Central District in the 60s and the 70s and the devastation it took on families and communities. We're doing some of the reparation work right now. So we're not leading with let's just arrest everybody. That is not the spirit of what came out of the Blake decision. So I'll meet with the city council members, we'll meet with law enforcement, and we'll figure this out together. And I look forward to these discussions. We'll be doing that work this month in June. And so in July, you'll see the outcome of this work. Thank you for the question. And I had a sneaking feeling it was going to come up.
Let me follow on that regarding treatment. The legislature put aside tens of millions of dollars for treatment and other related programs. Do you have any indication how much Seattle will be getting, and if that'll come due July 1 or?
Yeah. So, Joel, a few things, and I don't want to get in front of myself because my congressperson is standing right in back of you. I think in July we'll be able to answer that question better. And there's also, here's a problem or challenge we have. If someone is engaging in behavior that is either a threat to others or a threat to themselves, where do we take that person? What do we do with that person? And so we're looking at, during these next several weeks, where we take that person for treatment, okay? That's going to be the critical decision. And the other part, you have Chief Gonzalez here, that is, we're creating this third department, and it's taking some time, because we also know that we need this third department as a first responder to people that perhaps are a threat to themselves. And where does your people take them? So we're going to give you some specific answers. I want to do this work collaboratively, which quite candidly, you know, they were on the dais trying to figure this out yesterday.
Do you support the legislation that went before council?
I'm not on the city council. My position was not to support it or defend it. My position was to make sure the legislative process worked out. I would have done it differently, if you want to know, quite honestly. I would have had a committee meeting to have some robust discussions, to listen to the experts and the health community. How can you not? And listen to those that want to be safe. They're not, these aren't bad people. They just want to feel safe around bus stops and inside buses and in their neighborhoods. They want to feel safe. They're not bad people. Have this discussion and come up with something that meets everyone's needs. It's not that hard. That is a legislative process. Yesterday, my heart went out for all 9 of them trying to figure this out. But we're going to figure it out. That's the good news. We're going to figure it out. We're going to figure it out together, and we're going to put in the work this month. And July, we'll come up with some policies, and again, the specific answers are where we take people that are in need. And I ask everyone that can hear my voice right now that when I see 2 or 3 people huddle around tinfoil, that could be my friend. That could be someone that I went to high school with. My first impulse is, how can I help them? That's my first impulse. That's the mayor you elected. And that will always be my first impulse. But I have to recognize that someone else may see a threat in that person. And perhaps they're pushing a stroller with their child. I have to recognize that they need to feel safe. That is the calibration. And we need to figure this out in Seattle because the whole country is struggling with this right now. And I talked to mayors around the country on this. I believe we could figure this out here because we have the right people, and we certainly have the right youth. Okay. Oh, I was getting ready to shut down the questions. Man, that was my mic drop. Go ahead, you got it, sir.
So you said you watched some of the hearing. You probably heard some of the people who said if legislation like that is passed, we're immediately going to go back to the days of racist policing and communities of color being targeted. What do you say to those folks? I mean, you're the one, and the chief is here. You know, you're the two that are in charge of that effort.
Fair question. I think many of you know that I went to every precinct, met with every officer at every shift to impress upon them the Seattle that I want to see, particularly in the eyes of our police officers. You look at our submittals to the federal court from the consent decree, you see our use of force is admirable. We're doing what we're supposed to do. That I'm hopeful that the spirit, and this great leader of our police department, the spirit of leading with compassion, seeing the face of someone you're about to arrest and a face that someone that needs help, but also being ready to do your job. That under my watch, that this fear of going back to a war on drugs is not going to happen. It's just not going to happen. That is the beauty, I think, of having someone that grew up on these streets at T.T. Minor, Meany, and Garfield in the 60s. And I tell stories about that you have a certain lens, and the lens is always to try to help people. I understand mistrust of government. I understand that. But that's not going to happen here. It's not going to happen. At least in my administration, it's not going to happen.
After the tragedy that happened in November, the student union asked that they bring the ratio from 300 to 1, 300 students to 1 counselor down to 200 to 1. Has any headway been made on that effort?
300 counselors, I'm going to turn to a Quaker, from a bulldog to a Quaker. Can you help me up on that one, Dr. Jones?
So we're trying to create an ecosystem of safety and wellness for our students. And we're trying to treat the need instead of ratios. And so we're trying to understand collectively, that's why you see this group of people here, what can we do as a collective, as a partnership, to find resources, to be resourceful for how we can provide services to students. I wouldn't focus on the ratios because the ratios are a made-up thing. However, we have deployed more staff to help students, to help Principal Flo here and other places in other schools, 105 schools, to have more resources so they can serve students. And so, again, I want to press upon this body and us. When we talk about One Seattle, we're trying to create this ecosystem. We can't do it on our own. We're trying to do this in a collaborative way with evidence-based research, with some of the enforcement folks, mental health professionals. All of us are coming together to try to wrap around not just Ingram, but this whole entire city and this school district. And so I think you'll see our efforts being braided together over the next year or so.
Thanks, Dr.
For anyone who wants to answer. The term psychological first aid, can someone unpack that? Because I just think that's a very interesting term that I have not heard before.
Psychological first aid. I know I didn't use that term, so I'm not going to field that one. Would anyone like to take a shot at this? You didn't read the fine print when we asked you.
I didn't, no. So that is a term from, there is actually a package of ways that people have designed the interventions to support people when they're in crisis. And the reason why we say psychological is because oftentimes we don't make the connection between mental health and health. We separate them, and most people don't pay attention to the fact that mental health is health, that they're one and the same. The body doesn't know the difference between the two. So when we talk about psychological first aid, we're doing that intimate care for what our minds and bodies need without paying attention to the other parts that we usually do when it's first aid, like taking care of stopping bleeding and those kinds of trauma. The reason why the PFA approach or psychological first aid approach is used in crisis is because we often forget that people have to have immediate needs taken care of first. And so it gives us a way of being able to address those immediate needs and then moving to the ongoing long-term. Mental health approaches are typically long-term, regular, ongoing interventions, but psychological first aid is intended to be that first thing that we do. Does that help?
Regarding this, Garfield High School recently had 3 shootings outside of it. No students were involved, but given that and the incident here, the recommendations were made to increase security, video cameras, those sorts of things. What is kind of the line, I guess, that you see between, safety and also comfort? If students are being watched or, metal detectors, is there any psychological kind of negative impact on students feeling like they're being watched all the time?
Dr. Jones, do you want to answer?
Chief, maybe you could. Did you fully understand the question? Because I got lost a little bit.
A little bit, and I'm actually going to go back to the psychological first aid because actually this is actually it's actually good because it's actually been part of our work as well. You want to have get people to understand that it's normal to not feel normal in abnormal situations, especially when you have shootings that have happened around Garfield, or you've had a shooting inside Ingram High School, and you're having to take that first several days for just that unwind and unpackage that, because you have to make sure your needs are being met, but also then trying to get into some level of normalcy in practice. So when we talk about safety and security and stuff, people immediately say, like, we need officers to be present, or we need security staff to be present. But you're also trying to make sure that the emotional need is being addressed as well. And so that's really what this program will be about, is really trying to make sure the emotional need is being supported. But when it comes to actually safety and security, we are working closely with the schools. Not necessarily, it's not going to be necessarily having officers drive around, constantly, because we don't want the youth to feel that level of trauma. That is there some concern that I'm going to have an issue go on? We do get threats, routinely throughout the schools, and we have to assess them and triage them and try to determine, like, do we need to have a presence? And sometimes we want to try to minimize that presence because we don't want to create trauma among youth. When a student says they've been in lockdown a couple times in a year, and I can tell you one school has been in lockdown. They were in lockdown 7 days out of a 14-day period just a couple years ago because of the location of the school and where it's at. And so you want to make sure that at that point, then you do have a lot more presence of police officers, and trying to make sure that people do have that level of safety. But you also need those officers to be interacting in a positive manner with the students and in a non-enforcement way to try and assure the students that it is not just a level of making sure that we're going to be doing punitive action and around to them and their friends. So it's that balance, and that's what we're constantly assessing. We're working with the school district all the time, especially in around Garfield, especially in around the 9400 block of Rainier Avenue, because there's several schools in and around that location. But we're constantly assessing because we don't want to be part of the contribution of trauma. We want to make sure that we're supporting our youth, that they have the ability to thrive and have the ability to be able to learn in an environment. But also at times, there is going to be times where the youth are saying, we also do need an officer because just the nature of what's going on, we need to have that level of support. So we're always constantly in that communication and being able to assess that.
Thank you again. I just would add that there's a lot of guns out there. Last year we recovered over 1,350 firearms. In our first 3 months of this year, over 400 guns. And so as we continue to address the issue, we're doing everything possible to keep our youth safe. I'm going to take one more question, I think, and then we're going to call it. I heard that bell go off, so go ahead.
Can someone just address the prevention piece of this? And how can community be involved? A lot of the strategies, adequate sleep, diet, exercise, limiting social media, it seems to fall on youth themselves and families. So how does the rest of the community get involved in the prevention aspect?
Very good, thank you. Excellent question. Could one of our, and this would be our last comment, thank you. Good way to take it home.
Yeah, prevention is so many different things, and I think that sleep. How many hours are you working? I think it is part family, it's part school, it's part what's happening in the community. It's parks and recreation who is also involved, and the study work. All of these things I think will help with prevention, because what kids need is to feel valued, to know they're not alone, to have the basic things like sleep, food, housing, those kinds of things, and that all of those things go beyond the family. And what we want to do is pull all the sectors together to make sure when we see a kid in crisis that we're actually addressing it in the right way. And addressing a lot of these things like food insecurity, how you're going to have a job so that you can learn industry, learn how to help possibly with your family. All of those things help with psychological distress and prevention. And with all the sectors working together, we can really pool a lot of those resources and make them available in a very visible way for kids. So I think it is some in the family or where a young person lives, but it's also still everybody else that's around the community that the child lives in or teenager.
Thank you. The takeaway for me has been in looking at the development of this is we don't want it just to fall on the youth. You may know things that we don't know. We want to use that as a tool, but it can't just fall on you. It has to fall also on the community as assets to us. We'll get them the help, but we're putting the net out there, the structure out there to those 12 sectors, and the community's welcome. And together we'll get through it. Thank you very much, everyone. Have an awesome day. All right.